Hi, hello, my name's Harmi and I'm the OET course director here at West London English School. This video today we're going to be looking at listening part C, which is a tricky part of the OET exam. But we've got some tips and hopefully this video lesson will help get you through this paper. So listening part C, it's made up of two longer extracts, so it's quite different from parts A and B. You have presentations and you have an interview. Now interviews are generally, I think, easier to follow in that at least you know when you have moved on to the next question. Presentations can be a little bit more tricky because you have to really focus and you've got to identify when the speaker has moved on to the next question. So we've got presentations and interviews. They're talking about healthcare topics. Remember, listening, like reading, it's general to all professions. So whether you're a doctor, nurse, pharmacist, dentist, vet, everyone does the same paper. So you'll be listening to kind of a general healthcare topic. You've got 90 seconds to look through the paper. That's not a lot of time, but please try and put that to good use. And the testing points: attitude, opinion, detail and gist. And it's worth getting to know what these are. You can check out our other lessons if you want to know a little bit more about these things. Okay, so signposting. This is something we're going to look at today. And what is a signpost? Well, a signpost tells you which direction to go in. And you can see with language, it's basically telling you what is coming next. So when you hear someone say the most important thing is, well, what they're about to tell you is what the most important thing is. Similar to this, the reason for the operation is, well, I'm about to tell you why we're having the operation. Another example, the longer term objective is, well, I'm about to tell you what our long-term goals are. So with signposting, we're often telling the listener or the reader what's coming next. And this can be a useful skill to use in both reading and listening part C. Before we look at an example, I've got to understand the context. And context is really important. If you know what you're listening to, it really does help. So think about the context. We've got a paper here. I'm going to zoom in on this part here. It says you hear an interview with a cardiologist called Dr. Jack Robson, who's an expert on Chagas disease. Well, so you know it's an interview you're listening to, and you're listening to a cardiologist. The topic is Chagas disease. Okay, and think, what do I know about Chagas disease? It's a disease which is transmitted to humans from insects. It can cause problems with your heart or your digestive system. Found mostly in Latin America, not in built-up areas, maybe rainforests. And it can be treated. However, if it is chronic, it could be a lot more serious. So really what we're doing, we're trying to just use our own knowledge to really provide us with more context. Okay, here's a question. It says here, a patient called Marisol recently asked Dr. Robson to test her for Chagas because... Okay, and you've got to really understand the question and think, what are they asking me here? Well, they're asking you, why did Marisol want Dr. Robson to test her? That's really what they want to know, and that's something you've got to be able to identify as you're listening. We're not going to listen to this question. I'm just going to show you the tape script, and I've highlighted this little clause here. It says, what prompted Marisol to come to my clinic? Now you can see that they're directly answering, the speaker, Dr. Robson, is directly answering the question. He's telling you why Marisol came to see him. So the answer is going to come just now, or it came just before. But effectively, this is what we call signposting. The answer has been signposted. If I highlight this area here, and you can see here it says, the speaker says, hearing from relatives that Chagas can be transmitted congenitally was what prompted Marisol to come to my clinic. She and her partner wanted to start a family, and she was scared that she might pass the parasite on. And if I show you the answer options, you just take a few seconds to read these. You can see the answer is option A. So really understand the question, because that really does make a difference. And you can see how it was signposted here with this little clause. And as soon as you hear that, you know, okay, the answer is coming, or maybe the answer has just been. Be careful of distractors. Now you'll notice here that actually they do mention option B. The patient had been talking about donating blood. However, that's not why she went to see the doctor. So it doesn't answer the question. It's quite similar with option C as well. Talks about the patient was feeling unwell. Okay, but again, this doesn't really answer the question. That's not why she came to see Dr. Robson. So don't forget the question and keep the question in mind. You're always being distracted. Just because you hear something in the listening, it doesn't necessarily mean it's the answer. Okay, so let's do a little bit of listening. This is Chagas disease. This is question 1. You can see that I've taken away the answer options because we're really going to try and focus our listening. Listening part C, I think it's tricky and it's difficult because often you're reading and you're listening at the same time. But if you can really focus your listening and focus your attention on the audio, it can make a difference. So here we're just going to focus on the question. You can see the question here. Dr. Robson thinks the short-term priority in the fight against Chagas is to... And really what we have to identify is the short-term priority. And that's what we're listening out for. So let's see if it's signposted.
What can be done to combat Chagas generally?
Plenty. Researchers are working on improved drugs to treat it and a vaccine. None currently exists, but it takes at least 10 years to supply a new drug. Another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. There are also some very important programs using insecticides and other methods to wipe out the bugs that transfer Chagas to humans, but initiatives like those take decades rather than years.
So we are listening out for the short-term priority. You may have noticed, actually, when the speaker says this, that could and should be done almost overnight. So the answer was there. So the answer was quite nicely signposted in this question. The speaker, Dr. Robson, says another idea is to develop the existing drugs in tablets of different sizes. That could and should be done almost overnight. What's currently available is designed for adults, even though infants often have the disease. Now, if I show you the answer options, and if you take a few seconds just to read these. And you can see here quite clearly the answer is option B. Take care. Again, there are distractors. They did mention option A, something about eliminating insects or wiping out bugs. And again, you can see the use of synonyms or synonymous language here. But this was not the short-term priority. Also with option C, they did talk about a vaccine. Again, guys, this didn't answer the question. That's not the short-term priority. So be careful, really focus, don't fall for these traps, don't fall for these distractors, keep the question in mind and really focus on the question. Okay, and something else, of course, to be aware of are synonyms, as I mentioned there. What you hear in the audio will not be the same as what you read on your question paper, so you've got to be aware of this kind of synonyms or synonymous language as well. Okay, guys, we'll do another question. This time we're going to be looking at occupational therapy. Again, it's worth thinking about, what do you know about occupational therapy? These are people who are related to the medical profession, and they often help people who are recovering from some kind of therapy or illness or surgery. They often help them get back to work. So like I said, it's really worth understanding the context, as it can help you. So again, you've got your question here. Think about what you need to focus on as well in this question. What are they actually asking you? Again, I've taken away the answer options. So let's have a listen and see if we can get the answer without the answer options.
Ted showed little interest in receiving treatment. Some colleagues at the hospital took the view that if he stubbornly refused to help himself, there was little they could do. It was his right, they said. But I didn't agree. Since Ted couldn't use his legs or right arm, I made sure we concentrated on what he could do with his left hand. For example, I worked on strategies to help him dress himself and things like that. We even worked on fine motor skills, like writing with his left hand. I wanted to make sure that even if he didn't ever regain use of his right arm, I could at least get him to function by whatever other means were open to him.
Okay, so really that's what we needed to focus on. You can see I've highlighted this area here. Anna initially decided to focus on. We need to identify what her initial focus was. And maybe you heard this little phrase here when she said, I made sure we concentrated on. So as soon as I heard that, I knew the answer was coming. And if I highlight here, you can see she was talking about we concentrated on what he could do with his left hand. For example, I worked on strategies to help him dress himself and things like that. We even worked on fine motor skills like writing with his left hand. Okay, and I'll show you the answer options. Again, if you take a few seconds to read these. And you can see the answer here is option A, what he could achieve most easily. So again, the signposting is there with this question. Okay, we'll do another example, this time prostate cancer. And again, think, what do you know about this, this context, this topic? So prostate cancer. This time, guys, you're going to see everything. You're going to see the question, you'll see the answer options. Think deeply about the question and also the answer options as well. You've got 15 seconds to read everything. Think about what words you would underline to help focus your listening, and then the audio will play.
My name's Sandra Morton and I'm a specialist cancer nurse, helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients, recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective.
See here, the question, what we needed to focus on was the main aim of Sandra's work. That's what we needed to identify. What is the main aim of her work? And she said these two words. She said, it's vital. And as soon as I heard that again, I knew the answer was coming. So this was quite nicely signposted. It's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Okay, and you can see with the options, clearly it fits in with option C. Okay guys, so let's do one more question. Again, 15 seconds to read everything, really focus on the question, and also think about the answer options as well. The topic, overuse of painkillers.
But it's not just opioids we need to watch. Patients often self-treat with readily available painkillers like paracetamol. And while such drugs play an essential role in pain management, people still need to know more about them. We've been pretty successful in publicising the dangers of accidental overdose, and clear information's given about the effects of taking these drugs long-term, so public awareness about increased tolerance levels is also gradually improving. Many doctors also now actively warn patients about the spiral of taking higher and higher doses for pain relief. Worryingly, though, I've seen cases where people on drug regimes for other conditions inadvertently take painkillers which add a potentially hazardous ingredient to the mix already in their system. This is something which needs urgent attention.
Okay, so in this question, we needed to identify the main concern. What is the doctor's main concern? That's really what we're listening out for. Dr. Madison did say something at the bottom. He said worryingly, though, and this was actually really important. So the answer was signposted. He finished by saying this is something which needs urgent attention. The information between these bits of language had the answer. This is what Dr. Madison actually said. I've seen cases where people on drug regimes for other conditions inadvertently take painkillers, which add a potentially hazardous ingredient to the mix already in their system. This is something which needs urgent attention. Looking at the answer option, guys, you can see the answer is option C. Again, A and B, perhaps they were mentioned, but they were not Dr. Madison's main concern. In fact, they were distractors. So basically, just to recap, some things we've looked at today, understand the context. Context is always important, whether it's listening part A or even in part B, with reading as well. Context can really help you. If you know what you're listening to, if you know what you're reading, it really can make a difference. So think about the context and use the context to help you. Understand the question, underline key words in the questions. Think about verbs, nouns and adjectives. Think about what are they actually asking you. So really do understand the question. As we said, be careful of distractors. You might hear option A. It doesn't mean it's the answer. Just keep in mind the question. So be aware of distractors. Be aware of different question types as well. I mentioned this at the beginning of this video, but these are different testing points and different sub-skills. And it's worth getting to know what these are because they can also help you in reading part C as well. Be prepared to infer. Again, this could help you with reading part C as well. Inference, it's a useful skill to have. If you're not sure what this is, check out our other videos or, it's really worth looking into it. And approach each question individually. If you miss a question, don't panic. Let it go. You can still get the next mark. It's essentially 1 mark for 1 paragraph. So if you miss a question, don't worry, just keep listening and keep working. Remember, you'll have 2 minutes at the end of the paper to go back and check your answers and to go through everything. But really important, guys, don't stop listening. You only have one chance. They don't play the audio twice. So if you stop listening, it's really hard to pick it up again. Just stay concentrated, stay focused. And like I said, if you miss a question, just let it go. You'll have 2 minutes at the end when you can go back through the paper. But don't stop listening. Okay, so hopefully that's useful. There are some websites here to help, where you can help really build up your listening skills. There's stuff on the BBC website. There's some good podcasts here. Check out these links. Also, there's ABC if you want to be more familiar with the Australian accent. The Guardian is a newspaper in the UK, so there's some good reading in there as well as podcasts. And TED Talks as well. Okay, guys, also check out wles.net for our online courses. There's all sorts of stuff there as well. If you do need help with listening or with reading or with anything, in fact, also our YouTube channel, check out our other videos. Okay, guys, I hope you found that useful. Please do like and subscribe if you found this video helpful. If you're doing your OET exam, we do wish you all the best. Keep working and work hard. I'm sure you can get through this. All the best, guys.